Hello everyone, and welcome to our presentation on the 2011 Eleanor Clarke Slagle lecture titled Accentuate the Positive, Reflections on Empathic Interpersonal Interactions by Dr. Beatriz Abreu. I, Holly Webster, and my classmates Janice Mascarenas and Destiny Bolin will be presenting her Eleanor Clarke Slagle lecture article. Before we begin, a little bit about the author. She worked with TBI patients for nearly half a century. Prior to writing this lecture, she reflected on her years in practice and the defining characteristics that shaped her practice as well as her life. She decided to speak on this topic once she came to the conclusion that positive, empathic interpersonal interactions have been one of the most important factors in her personal and professional development. Largely because in her experience, empathy tends to be one of the most basic ingredients responsible for changes that occur during intervention. Through her Eleanor Clarke Slagle lecture, Dr. Abreu aimed to heighten awareness of the importance of empathy and to foster a clearer and broader perspective on the elusive process as it applies to the brain-injured population. Furthermore, she believes that focused reflections on empathic care can illuminate the art and science of occupational therapy and promote our development as well as that of the people we serve. During this presentation, I will cover a brief introduction on the topic, such as what is empathy, before discussing empathic interactions as they relate to occupational therapy. Janice will then discuss interdisciplinary knowledge from positive psychology and social neuroscience that can enhance understanding and use of these interactions. Lastly, Destiny will discuss Dr. Abreu's reflections on positive empathic interactions in the workplace and conclude with a take-home message. One of the guiding beliefs of occupational therapy is that through positive empathic interactions, we reach out in a caring manner, trusting that the people we work with will find their own strength. However, a national survey conducted by Taylor, Lee, Kielhofner, and Ketkar in 2009 of 568 practicing occupational therapists in the United States found that although more than 80% of the participants reported a high value for the therapeutic relationship and use of self, they felt that they were inadequately trained and that the field lacked sufficient knowledge in these areas. Only 4% of these therapists reported that they took courses specifically on the therapeutic use of self. People engaging in the empathic process use their abilities to feel, detect, imitate, and express emotions, and to communicate verbal and nonverbal signals to understand each other. Research suggests that empathy is an imaginative, creative, and imitative process that depends on 4 factors. 1, the willingness to enter the other person's emotional state. 2, desire to use the self as a motivational agent of change. And 3, competencies for language expression. 4, readability of social communications. To interact with another through a lens of empathy means to see into and feel into their experience, so as to understand their perspective, with appreciation for them as a human being. Empathic interactions also involve adjusting your style of communication, so as to clearly communicate your understanding of their experience and your compassion for their perspective. Empathy promotes humanistic or person-centered practice and may foster a positive and improved understanding of social interactions. Empathy differs from sympathy in that empathy involves the ability to identify and understand another person's situations and feelings, can understand another situation, may have similar experience in the past, and the understanding and acceptance are evoked with empathy. Sympathy involves feelings of sorrow and pity for someone else's misfortune. It also includes being unable to understand another situation, maybe not having similar experiences, and is encompassed with a pity, sorrow, and concern that is evoked. Many scholars agree that empathic interactions and accentuating a positive perspective are critical for competent and compassionate healthcare. In her 1975 Slagle lecture, Josephine Moore proposed a focus on the emotional component of behavior as a guiding principle for neuroscientific-based practice. She suggested that practitioners perfect their ability to relate to others on an emotional level instead of functioning entirely in an intellectual manner. Caroline Baum, in her 1980 Slagle lecture, called us to recommit to empathic care in the health system. She stated, "Through our professional relationships, we reach out and with empathy show that we care, hoping that from this caring, the person will find his or her own strength." In a similar fashion, Winnie Dunn, in her 2001 Slagle lecture, advocated an accentuation of a child's positive tendencies so as to balance the image of children with sensory processing problems. Wendy Koster, in her 2008 Slagle lecture, also promoted an accentuation of the positive when she suggested that occupational therapy measures have the power to positively shape the story that others hear about the people we assess. She advised therapists to persuade others to tap the strengths of clients to develop comprehensive interventions. The discussion of positive empathic interactions has been led by Suzanne Pelequin in 1995, who had used empathy as a value and a means of reclaiming the profession's heart. Her numerous writings on empathy have been described as serving as our profession's inner voice that inspires us and calls us back to the art of practice. Her call relies on positive empathic interactions as a critical value. She believes that the empathic process requires being sensitive, respectful of differences, and fully present to the other person. She asserted that empathy enables the act of doing with so that it becomes an expression of being with, and that both therapeutic actions empower and encourage each other. Affirmations of empathy exist in the literature. There is limited evidence for the measurement and the development of empathy as a foundation for improved therapeutic interactions. One empathy measure used in occupational therapy was the Kagan Empathy Scale. When researchers administered this scale to students before and after completing a seminar and a group process course, they found that the course had positively affected the students' empathy. In addition, a 2010 study of Australian OT students using the Jefferson Scale of Physician Empathy and the Medical Condition Regard Scale found that the students showed variable empathy levels depending on the diagnoses of their clients. The students held substance abuse in comparatively low regard as compared with other conditions such as stroke, traumatic brain injury, and cerebral palsy. This result provides further support for the need for more training in the area of empathy. There are few empathy studies focusing on the client's perspective. However, Pelequin's phenomenological exploration of this topic in the 1990s focused on the narratives of clients and sought to better define their perceptions of the meaning of empathy, as well as its absence, often called depersonalization. In addition, a 2010 follow-up qualitative study by Sharon Myers, a counseling psychologist, and Catherine White, an occupational therapist in Canada, confirmed that empathy can act as a catalyst of personal growth. They found that 10 years after treatment, clients continued to credit the empathic therapeutic relationship as the basis for their personal growth. The two predominant themes that emerged were, 1, therapeutic relationships were a foundation for change, and 2, they led to affirmation and enhancement of the personal agency of clients. In another study by Cordier and colleagues in Australia, researchers used the test of playfulness to compare play in children with attention deficits with typically developing children. Results suggested that children with attention deficits seemed to lack empathy in play due to their egocentric responses. The work of these scholars supports the need to expand research on the measurement and development of empathy as a foundation for improved therapeutic interactions. Support for empathy as an important contributor also comes from positive psychology and social neuroscience.
Now we will move on to discuss interdisciplinary knowledge from positive psychology and social neuroscience to better understand our empathic development. Positive psychology is a scientific study of strengths, personal well-being, and optimal functioning. The aim of positive psychology is to improve health at 3 levels. The first level is the subjective level, which includes fostering hope, optimism, flow, and happiness. The second level is the group level, which includes fostering civic virtues, citizenship, tolerance, and work ethics. And the third level is the individual level, which includes promoting the capacity for interpersonal skills, perseverance, forgiveness, and wisdom. Research in positive psychology has provided evidence that empathic experiences and expressions of positive emotions are related to health, success, and longevity. Fredrickson theorized that optimistic emotions increased attention and well-being, reduced negative emotional states, encouraged resilience, and overall helped to improve well-being, whereas negative emotions reduce the range of thoughts and actions. The literature has also shown that attitudes, values, knowledge, and responses related to empathy may be affected by gender, age, and culture. Many studies support the view that women are more likely than men to express positive emotions. It is known that men and women express emotions differently. Men may express emotion through external characteristics or body language, whereas women may be more likely to vocalize their internal emotions. For example, when describing a heated discussion between a male and female, observers in a study depicted that the female emotion as she is hysterical versus the male emotion as he is just having a bad day. Another study found that women are more likely than men to perform activities associated with service. This finding was an indication of the established gender roles in society where women perform more caretaking roles than men, causing women to be perceived as being more empathetic. However, because gender-related expressions are influenced by our established social norms, we must be cautious not to reaffirm gender stereotypes. Age is also associated with the experience of positive emotions. Many older adults experience positive emotions and well-being in contrast with their cognitive and physical declines associated with aging. Research by Austere and colleagues proved that positive emotions are associated with lower blood pressure and increased functional recovery and resilience in patients after stroke. This tells us that maintaining a positive sense of well-being is an important component of successful aging. Positive psychology also shows that our web of personal and professional social relations shapes the way we define ourselves, our positive emotions, and our empathy. Culture can be defined and described in many ways, and the values of a culture also vary per cultural group. Therefore, positive emotions may differ across cultures depending on the individual or group's needs and values. For example, wealthy cultures associate positive emotions with love and self-esteem needs, whereas poorer cultures associate these emotions with safety needs. But despite these differences, it is widely agreed upon that positive emotions improve empathic interactions. Social neuroscience is another interdisciplinary field that has shed much light on the role of empathy in positive interpersonal interactions. Similar to research in positive psychology, social neuroscience has also shown that empathy may be affected by age, gender, and culture. Research has shown that infants can perceive and respond to another's emotional state. Very early signs of this empathic development are displayed when one newborn cries in response to the cry of another. At 1 year of age, infants can also show signs that they are able to comfort others in distress, and by 14 to 18 months, some children even display spontaneous helping behaviors. Dosh and colleagues suggested that prefrontal cortex activation is important to empathy in adults and that it is associated with empathy in children as young as 6 years of age. The prefrontal cortex develops further and reaches maturation late in adolescence. The This brain maturation affects executive function and language, which are two higher cognitive abilities that influence empathic responses. This later development explains why teenagers sometimes seem to display poor judgment and problem-solving skills and appear to lack empathy. Gender differences have also been reported in social neuroscience literature. Some reports indicate that women activate more brain regions related to emotion, whereas men activate a different brain network associated with cognitive evaluation, mentalizing or mind reading, and behavioral anticipation. Other research maintains that women show a stronger ability to make eye contact than men do, implying that women may have an enhanced tendency to empathize, as observing a person's eyes can lead to interpretation of that person's emotions and intentions. Cultural context has been viewed as a source of information that shapes empathy through teaching, imitation, and other forms of social interaction. Social neuroscientists believe that culture is dynamic and capable of affecting change and evolution. With increasing abilities to travel across the globe and have instant access to a wide variety of news and information, we've created automatic and conscious cultural patterns that influence our empathic interactions. Scientists view the brain as the structure that empowers the individual to create and change culture, and they also believe that culture can, in turn, shape the brain. In her lecture, Dr. Abreu states that she believes the interdisciplinary knowledge gained from aspects of positive psychology and social neuroscience can help us expand our understanding of empathy. And with such knowledge, we can encourage collaboration as well as the translation of knowledge into occupational therapy practice.
In her lecture, Dr. Beatriz Abreu reflects on 6 positive empathic interactions in her clinical practice working with individuals with traumatic brain injury, and how she accentuated the positive in an empathic process throughout these interactions. Behind each interaction is a guiding implicit question being asked by the client. So keep in mind that although these interactions reflect her experience with patients with TBI, these can be used as a guidance among any empathic interaction, regardless of the population. So the first positive interaction that she shares is when she shared resilient stories as a source of inspiration and motivation. So within this interaction, she shared her patient stories about how people transformed hardships into stories of triumph. When listening to the patients, the guiding question that she heard from them was, how do others like me cope and adapt? And so the takeaway from this interaction for us is to first attend to your patient's acceptance level with their injury or illness and share matched stories of resilience and triumph. Another thing you can do is mention case studies and research regarding the strength and recovery of other individuals with the same trajectory. These stories will not only enrich your patients' lives and experiences, but yours as well. The second interaction is the willingness to enter the other person's emotional state and perspective. So here the client's guiding question is, are you sure you want to enter my world? And because individuals with TBIs, moods and behaviors can fluctuate, she shares that our interpersonal interactions need to be flexible and confluent with the person, situation, and environment. Challenging interactions require empathic adjustments to the other person's world. So think about the ADLs of bathing, showering, and toileting, for example, and how private those occupations are. You want to learn to maintain dignity for yourself and for your patients and really foster empathic interactions during those private training interventions. She mentions that many clients who longed for the resumption of washing their hair, taking a long shower or a bath, or cleaning their intimate body parts actually willingly granted permission for therapists to share and occupy their private space. And so that just shows that empathic interactions during those private training interventions are essential. And the third reflection is reading other people's actions and language patterns, variations, or prosody. This interaction is guided by patients' implicit question of, how can you better understand our language? So language carries emotions either by, what is said or how a person says it. And consciously and constantly reframing your verbal and nonverbal communications will increase your ability to read the clients and really communicate more effectively with them. The fourth positive interaction that she mentions is promoting other people's hope and strength, and that is guided by the patient's question of, what can my hope and strength be? And while we cannot predict outcomes with accuracy, it is our duty to accentuate strengths and implement best practice, regardless of the circumstances. So she mentions that we must constantly reframe our thinking and either downregulate or upregulate our emotions to focus on a client's potential for hope and strength. Using positive psychology strategies, such as encouraging the clients and their caretakers to examine the situation from all sides and completing small steps and partial goals in the face of conflict. One specific strategy that she used was asking her client and caretakers to write down 5 strengths and 5 things that they were grateful for, and she encourages them to share those 5 strengths and things they're grateful for during every treatment session. And what that strategy does is it really expands her understanding of their strengths to a high degree, and it allows her to utilize the strengths during treatment planning. And the fifth positive empathic interaction is teaching and using reflection and self-regulation strategies that is guided by the patient's question of, how can I problem solve more effectively? So here we want to teach our patients to engage in conscious prediction, monitoring, and planning of their occupations with a focus on their capacities, the demands of the task, and the strategy or rules of behavior. So examples that she shared using were promoting the self-talk for problem solving with the client, as well as external feedback with checklists, signs, or even verbal feedback. And that really allows the patient to experience self-success through reflection and self-regulation. And last but not least, the sixth positive empathic interaction reflection that she mentions is the use of creativity and imagination. So the guiding question here is, can we have fun today? So she found that clients were really absorbed, motivated, and happy when they were playing games, singing songs, writing poems, drawing, and even making jewelry. So that is truly the art and uniqueness of occupational therapy, because occupational therapy, it's a career of art and science. So using your creativity and imagination to foster your patient's hope, resilience, and empathic interactions is what you should truly aim for during practice. And to finish, I will leave you guys with a concluding statement from her Eleanor Slagle lecture of Accentuate the Positive. So she states, I hope that I have been able to bring more awareness of the role of empathy in the art and science of occupational therapy. We need to continue to foster our science while we reclaim our art of practice. When we accentuate the positive, we begin that reclamation. And here's the reference for her Eleanor Slagle lecture. And then during class today, or during lecture, we will be splitting up into groups and going over a few case studies with questions regarding how we can really implement and take these 6 positive interactions that she mentioned, and how we can implement these empathic interpersonal interactions in practice. So I'll see you guys in class.